It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network featuring some of the best doctors in all of the Dallas-Fort Worth area that are helping to change people's lives.
Right, Candace, this is the place to come to find the doctor just right for you. Like our first doctor, it is Mohs Surgeon, Dr. Patrick Walsh.
In our practice, we really emphasize patient autonomy. We feel it's very important, probably the most important thing we do. We want the patient to be involved with every step of the process in our office so they understand the nature of their skin cancer, exactly what it is we're going to do in order to remove the skin cancer, and what their options are after the skin cancer has been removed.
I have had skin problems for most of my life. When I was young, I tried to always get a suntan, but instead of getting tan, I got sunburn, and then I would just peel off.
Reverend Turner is a fine gentleman who has very fair skin and has had a lot of time outdoors, and he's developed a lot of very superficial squamous cell and basal cell carcinomas, predominantly on his scalp. Once they're diagnosed, we've removed a number of them using the Mohs technique.
It's very effective. I'm glad that I can have his expertise in treating my problem.
Anyone that develops skin cancer should be seen by a dermatologist every 6 months. And that's because we know that skin cancer is due to exposure to ultraviolet radiation. And unless you have left the rest of your skin someplace else whenever you got sufficient sun exposure to get your first skin cancer, all the rest of your skin that was there is susceptible to the same mutations that gave rise to the skin cancers.
I'm 79 years old and I'm still here. He's helped me to get as old as I am.
About 4 months ago, I had a gastric bypass. I was obese and having a lot of chronic issues like diabetes. 5 days later after having the gastric bypass, I was no longer diabetic. I was not dependent on insulin or metformin or any of the other auxiliary drugs that are prescribed, no longer, and it feels good.
She's been doing really well. She came in today talking about dress sizes and how she's having a hard time adjusting to the fact that she's down to about a 16.
I have in mind what my size is, but the mirror and the clothes say something totally different. I went shopping a few weeks ago and I got 4 size 16 dresses. 4. I have not seen a size 16 in over 10 years.
It's kind of like you're on a journey and you're trying to get from point A to point B. And if you have a map, you can get there. But if you're just kind of wandering around, you may get there, you may not. So if you pay attention to what you're doing and you know what the facts are, then you can make changes.
90% has been me, but Dr. Swanson's been there every step of the way. Even though I may not have a scheduled appointment, I'm welcome here to come and see him anytime. That support is there. I can call anytime.
People come back real regularly and I talk to them. I think it's important to maintain that connection, to have the guy that you believe in, the surgeon who's doing your procedure, who knows about it, who knows the most about it, being in contact with you.
So far in my journey, I have lost close to 50 pounds. And as I continue, I hope to lose a total of 120, maybe 125.
We do the surgery, it's almost like pushing the restart button. We give people a second chance.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
Here at the Best Docs Network, we are all about helping you find the doctor that is just right for you. Up next, let's check in with our next doctor. It's plastic surgeon, Dr. Robert Wilcox.
I had 2 children in the last 4 years, which is wonderful. I wanted to, get back to my normal shape, and I, started looking into getting lipo and things like that, and so I found Dr. Wilcox.
Well, liposuction is still one of the most popular cosmetic procedures done nationwide, as well as in our own practice. My preferred technique is ultrasonic liposuction, and that has proven the test of time. It's been present for about almost 15 years. Rather than just literally ripping the fat out, the cannula or wand is made of titanium. It's about this length. It has a hollow bore down the middle for suction. The tip of it vibrates over 20,000 times a second, and that's how it gets its name, ultrasound. And so we can just go back and forth gently until we can get about 2/3 of the thickness of the fat removed.
So I came in, told Dr. Wilcox that I would like to slim down around the hips, look at some areas of the stomach where the fat wasn't coming off. So he explained to me, he showed me what all he could do and what the result would look like. I was pleased with what his expectations were.
First of all, during the consultation, I make clear to them the best thing about coming to our practice is they're going to get the straight story. There are many patients every week who come in where I explain, I don't think the surgery's for you. We may be able to offer a non-operative measure, or maybe they just need the encouragement to realize they don't have the problem that they perceive in the mirror. In Victoria's case, she came in requesting the breast enhancement and liposuction, so we looked at her and looked at the common areas that are usually done. And she has a nice figure and she was close to her ideal weight, but she had enough fat on her hips and abdomen that we could help her with that and make a significant difference.
I'm extremely happy with the results. They've exceeded my expectations as well as my husband's expectations. It is a quick recovery for such a big result that you get. It's just very exhilarating because I just have me back.
I had a bad problem of grinding my teeth. And 30 years ago, I had some beautiful teeth. And, they slowly got worse and worse and worse. And then, of course, I started having cavity problems. And my regular dentist told me, look, they're not going to last your lifetime. So you're faced with either dentures or redoing your mouth.
Many patients find us because they're at the end of the road on their dental history. They have neglected their teeth, or they've had habits that have caused their teeth to wear down to the point where they know they have to do something. And they present sometimes after many decades of problems, and they're ready now to fix those problems the best they can afford to. A lot of the patients fall into the full mouth reconstruction category, which means they need every tooth in their mouth addressed in their treatment.
When I finally went to Dr. McFadden, I was looking to him for a permanent solution and something that would last the rest of my life, obviously. And then calmly brought me into his office and literally wrote down on a piece of paper, here are 3 different proposals. After weighing it, I decided to take the highest cost option for me, which was to put crowns on every tooth.
When Bob came to the practice, it was a really fun appointment. He was instantly charming and fun to be around, and we became friends throughout his treatment. When Bob arrived, he had had 4 decades of tooth grinding and ended up with almost no tooth structure left, and his wife hated his smile. We were able to use all of his teeth and perform certain procedures to allow him to keep his natural teeth and improve the way they look through crown treatment. One of the funniest things about Bob is that he carries his before and after pictures on his iPhone. He shows everybody. He shows people that don't care at all what his teeth look like and how great his teeth look now.
He cares, incredibly cares, how good your teeth are. A little bit obsessive compulsive he is, but it works out in your mouth to be beautiful.
We are here with one of the best doctors that specializes in the back and neck. He is a pain management specialist, a board-certified physician that treats problems with the back and neck. And some of your patients that come in, what are the most common symptoms?
Well, patients that come into my office often complain of neck pain that may or may not be associated with arm pain, numbness, or tingling, or shoulder pain, numbness, or tingling. They also might be complaining of thoracic or mid-back pain that may or not be associated with numbness, tingling, or pain radiating around to the ribs. Most commonly, they come in complaining of low back pain that may or may not be associated with leg pain, numbness, or tingling, or otherwise known as sciatica. What we find out is, upon evaluation of these patients, that this procedure addresses these conditions such as a herniated disc, a bulging disc, scar tissue that might be in the spine from trauma, or even patients that have already had a surgery on their back and or a fusion of their back that still can be treated with this minimally invasive procedure.
Dr. Williams is one of the only specialists in the world that does a minimally invasive procedure that can detect and treat neck and back problems. Explain this procedure.
What I do is I make a very small 2 to 3 millimeter incision in a natural opening above the patient's tailbone without damaging any bone. It also has a laser, a state-of-the-art laser, and a high-definition camera that I can drive up to the patient's, into the patient's spinal canal and examine the patient's spine for herniated disc, bulging disc, scar tissue, inflammation, and then treat that patient's pain or a condition right there.
All right, Dr. Williams, so I have the procedure on my back or neck. What about the recovery time? How long?
Well, I'm glad you asked that, Jim. Since it's such a minimally invasive procedure and an outpatient procedure also, I usually can have a patient back at their desk job or office job the next week after they have the procedure.
All right, there he is, Dr. Jason Williams, the go-to doctor when it comes to back and neck problems. All right, thank you, doctor.
Thank you so much, Jim.
Don't forget to find the doctor just right for you. Head to the website bestdocsnetwork.com to get more information on any of the outstanding doctors you see on today's show.
And now we're going to head over to our next doctor. He's a pain management specialist and PAMA physician. It's Dr. George Farhat.
I was experiencing chronic neck pain, so I searched the internet and found Dr. Farhat through PAMA. I had burning, intense burning down my arms and out of my fingers. Almost felt like kind of like electricity, but also like a hot fire poker constantly.
When I saw her in the office initially, we adjusted her medications so we can help her cope with her condition. Then I did what we call diagnostic medial nerve branch blocks, where we injected enamel medicine around the sensation nerves that carries the pain signals from her neck to her brain. The procedure helped. And as a second step in her treatment, we did the rhizotomy.
He suggested a rhizotomy, burning the nerves in my neck, which kind of scared me at first.
We've done this procedure a few months back now, and Amy has been doing well since.
It was wonderful. I have no pain whatsoever. It's completely gone. Now that I'm pain-free, I am back to work. I work 6 days a week instead of just every now and then. And I am very happy that Dr. Farhat has given me this pain freedom.
She got so much better that she asked her husband, Shaggy, to come and see us. He has something similar in his lower back, and we ended up by applying the same treatment we did on her, on him.
My wife told me about Dr. Farhat at PAMA, and so I decided to come see him. And he says, you know, I'm going to make you pain-free. And of course, I've heard that a lot of times, but whenever he said it, he actually means it, and he actually does, you know, come through. Since then, he has done 2 rhizotomies on my back, and now I'm pain-free. It's wonderful. I'm not limited to my mobility, and I've got my life back. And Dr. Farhat is always very polite. He always comes in and greets you with a smile. His staffing is always very nice, very polite, very helpful. I don't think they are ever in a bad mood or ever have a bad day because they're always so polite.
I'm very, 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 very pleased at how much he cares.
I never had an experience as I had with any of the other MRIs I've had over my lifetime. I came here and I thought I was back at my own house, and the people were so welcoming and caring. Time they need to work on you. That I never had that kind of attention. Over here, they were very concerned with my state after the MRI was finished, so they have chocolate cookies, they have candy, they have whatever you want, water, or so forth and so on. Sit down and wait and rest. This is unusual for me as a patient. I'm really happy that the doctor and the radiologist found some specifics that made my procedures less than they would have been and much easier for everybody. So I'm very appreciative of Preferred Imaging and its staff.
Having that peace of mind was very important because once I found out that I was going to stay off for just some time and I realized it wasn't like a rupture or something like really severe, that really like kind of eased the burden within me, and then I kind of can project and have a game plan as far as when I want to get back out there and start working out again and running. Gave me a lot of peace of mind.
Cholesterol is an important thing. You need to know your cholesterol number. Now, there are 3 numbers when it comes to cholesterol. There's total cholesterol. That's important for diagnosing whether you have a problem or not. And then there's HDL cholesterol, that's the good cholesterol. You want that to be high. If you're a man, you want your HDL cholesterol to be above 40, and if you're a woman, you want your HDL cholesterol to be above 50. Now, the LDL is the bad cholesterol. That's the most important number to know because that's the one that predicts your risk of heart attacks and strokes. For example, your LDL for most people should be less than 160. Now, if you have certain diseases like hypertension or diabetes, or if you're getting older, then you really want it to be 130. That's the LDL, 130. If you have certain diseases like diabetes plus hypertension, then you're kind of want to look at a number that's under 100. Now, if you have heart disease or have had a stroke or have significant risk factors in your family, for example, for early heart disease, then you really want your LDL, that's the bad cholesterol, to be less than 70. So know your number. Your doctor can get it for you pretty easily.
For more information on any of the outstanding doctors you see on today's show, more videos to learn from, head to the website bestdocsnetwork.com. That's the place to go to find the doctor just right for you. Right now, the place to go is our next best doctors. That is podiatrist Dr. Holcombe and Dr. Williams.
Bunions are an angular deformity of the big toe. It causes a prominence which then rubs on shoe wear and often becomes painful.
When you develop a bunion, it's actually this part of the bone that becomes prominent, and the metatarsal starts to move inward, and the big toe actually starts to move towards the second toe.
There are various degrees of it, and they're often hereditary in nature. Contrary to popular belief, it's not from bad shoe wear, although certain shoe wear can obviously aggravate the condition.
Conservative treatment for bunions is limited to basically wearing shoes that have a wider toe box and allow for more room and less pressure of the area.
But often it requires surgical intervention. The surgery for it can vary. There are multiple different procedures to do. Typically what we'll do is take some digital x-rays on a patient and evaluate and discuss with the patient what is the best option for them.
Which involves basically shaving down the bump and moving a portion of the bone over and realigning the toe so that it sits straight once again.
There are other conditions that can affect the big toe, such as hallux limitus. That is an arthritic condition of the big toe joint.
This is different from a bunion in that the pain is located more on top of the toe joint as opposed to on the inside of the foot.
Those symptoms are usually with walking and higher heeled shoes. It's often how it starts. You can notice it squatting.
Every day, every step, it would hurt. And so now, 5 weeks post-op, I don't have the pain that I had just from walking down the mall. I'm really glad I did it.
Following surgery for hallux limitus, the patient will begin to experience a decrease in pain within 7 to 10 days and also an increase in range of motion at that big toe joint.
She actually told me that if I did not have it done, I'd end up with a fusion or a joint replacement. And a fusion means that you will never wear a high heel. It's like your toe is like straight, there's no bending it. That didn't seem like a good option. And who wants a joint replacement? I want my own joint.
We're all different. We like different things. But one thing nobody likes is pain, especially when it keeps us from doing the things we love. Luckily, PAMA's here. Whether it's back pain, carpal tunnel, foot and ankle pain, or more, PAMA physicians are dedicated to their specialties and dedicated to your quality of life. Don't let pain keep you from doing the things you love. PAMA, pain freedom.
Carpal tunnel syndrome is very common. It's probably the most common thing a hand surgeon sees. The thing with carpal tunnel syndrome is a lot of people get diagnosed with carpal tunnel syndrome that don't really have it. So it's very important that if you have hand pain, numbness, or tingling, that you see a qualified hand surgeon and make sure you get the right diagnosis. Once we get the diagnosis of carpal tunnel syndrome, treatment is geared to trying to take pressure off of the median nerve in the carpal tunnel. Initially, we try to do that conservatively. And the way we do that is with steroid injections into the carpal tunnel, which decreases the swelling around the nerve and takes the pressure off that way. We also place the patients in wrist splints that hold their wrist in a neutral position, particularly at night, because nighttime seems to be when the symptoms are worse. And if we can release the pressure on the nerve in that way, the patients can get significant improvement without having to have the surgery. There are many different kinds of surgery for carpal tunnel syndrome. The minimally invasive techniques serve to go through very small incisions and then cut the ligament that sits on top of the nerve. And by cutting that ligament, the ligament splays apart and takes the pressure off the nerve that way. And that's a permanent fix. The incisions we make are very, very small. They're in the base of the palm and only about 1 centimeter. We only need one incision to do our version of a carpal tunnel release. This is comparable to any minimally invasive or endoscopic procedure out there. And we're able to go through this very small incision back to the carpal tunnel and release the ligament that's squashing the median nerve. It only requires a few stitches to close, and patients recover very, very quickly with minimal scarring. All of the minimally invasive techniques and endoscopic techniques have very similar results as far as pain, post-op recovery, and patient satisfaction. Now, it doesn't recover right away, so to have some numbness and tingling after surgery is actually normal because the nerve is regenerating itself. And in severe cases, it can take 6 months to a year before you know what your final outcome is going to be. However, that painful burning numbness that patients typically feel usually gets better within a few weeks or sooner even.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
On a day-to-day basis, I was experiencing chronic pain, a chronic migraine all day, 24/7. I'd wake up with one, I'd go to bed with one, and it would never go away. I tried everything from acupuncture, a chiropractor, nerve blocks, spinal tap, and there was no relief with anything.
When Jennifer first came in, she was 17 years old, had been totally debilitated by her headaches, had been basically housebound, was homeschooled, hadn't been able to do all the normal stuff teenage girls do during high school, just because of her chronic daily pain. And so we talked, decided she was a good candidate for the trial, and then when we did the trial, when she came back several days later, she'd been almost essentially pain-free from the time we put the trial in to when she came in to take the trial out.
The 5 years I experienced chronic daily migraines, I was completely limited. I couldn't do anything, stuck at home, dark bedroom, cold room, the typical, I've got a migraine, don't talk to me, irritability, everything.
We've been using stimulators for chronic back pain for 30 years or so, and Dr. Reed decided one day somebody with headaches to try putting a stimulator over the peripheral nerves that supply around the scalp, and the patient had really good relief, and that's how it all kind of got started. Now to have a procedure that gives people either complete relief or 80–90% relief, that was real dramatic, and that was, just the stories you get back from patients was what makes it worthwhile.
I can do anything. I feel like I can experience anything. My pain isn't holding me back. I'm, going to school, experiencing life to the fullest as where I wasn't before. The neurostimulator completely gave me my life back. My life has completely changed. I've done a 180, and I feel that I can experience anything because I'm pain-free.
Well, that'll wrap up another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas-Fort Worth area that are helping to change people's lives.
That's right. For more information on any of these outstanding doctors and to find the doctor just right for you, head to the website, bestdocsnetwork.com.
And if you have a question or comment for us, send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.